Our next abstract will be presented by Ms. Faith Moyo. Ms. Moyo is presenting longitudinal evolution of maternal viral loads during pregnancy and postpartum among women living with HIV in South Africa. Ms. Moyo is joining us from the National Institute for Communicable Diseases in South Africa.
Good day. My name is Faith Moyo, and I'll be presenting on the longitudinal evolution of maternal viral loads during pregnancy and postpartum period amongst women living with HIV in South Africa. I have no conflict of interest to declare. I would like to thank my supervisors for their guidance on this work, my colleagues at NICD, as well as the Elmer Foundation for funding this work. So by way of background, 1 in 3 pregnant women is HIV positive in South Africa, and this translates into about 270,000 HIV-exposed neonates per annum. And we can see from the figure that this statistic has remained constant for about 1.5 decades. HIV screening and antiretroviral therapy coverage rates are very high amongst antenatal clients, at more than 95% in the public health sector. The national intrauterine transmission rate currently sits at less than 1%, and this is according to routine laboratory data. Despite the low PMTCT rates, ending pediatric HIV in South Africa is challenged by a number of factors. For example, there is a high maternal seroprevalence rate in the country, such that the current IU rate of less than 1% actually translates to about 240 cases per 100,000 live births. And postnatal transmission rates are estimated to contribute a further 1.5 times to 2 times the IU rate nationally. Secondly, the national PMTCT program contends with high rates of seroconversion during pregnancy and the breastfeeding periods. Lastly, viral load monitoring during pregnancy and the postpartum periods appear